In this video, we are going to discuss what you can expect if you have a C1 to C4 injury. In the cervical spine, there are 8 vertebrae. The higher the injury is on the spine, then the more dysfunction will be present. When you have an injury from C1 to C4, this is the most severe level. The learning objectives are listed above. We're going to help identify activities that you may need assistance with and equipment that might be helpful to you. And then we'll also give you an understanding of what level of function you can expect with the C1 to C4 injury. So what are some things that you'll be able to do? You'll be able to direct your own care. You'll be able to advocate for yourself. You may be able to use a power wheelchair with controls that are designed specifically for you so that you can move on your own. And you may be able to eat and drink with adaptive equipment. Some things that might be different for you include not being able to move your arms, trunk, lower body as you normally would, and with that, you might not have control of your bowel and bladder movements. Also, with your injury being higher up in the cervical spine, then those are the muscles and nerves that are also in control of eating, breathing, talking, and those will be affected as well. So you might require some kind of device to help you talk or breathe. When you leave the hospital, you will need 24-hour assistance from a caregiver. This caregiver will be able to help you with eating, bathing, dressing, showering, and all of your other activities of daily living. This also includes moving from place to place, or what we call transferring, so going from your bed to a wheelchair or chair. Along with having a person who can help you out, there are also several different pieces of equipment that you can trial to see how they work for you. For example, a piece of equipment that might be helpful for you would be a hospital bed with railings on the side that you can hold on to help reposition yourself, and also it will go up and down so that your caregiver isn't straining their back or different parts of their body to help you move around in the bed. Next, we have a mechanical lift, or also called a Hoyer lift. As you can see, a sling is placed under the person, and then this device will help to transport the person to their next location. There are also several different pieces of adaptive equipment for eating and drinking. This is just one shown here, where on that blue handle, someone can place their hand and then in a rocking motion, use their hand to cut whatever food they have in front of them. Pictured here in the blue is what we call a universal cuff. It can go around many different objects like your toothbrush, hairbrush, or even forks, spoons, other pieces of silverware, and you'll loop your hand around the other side as pictured here on the left. And what that does is it helps people who don't have a lot of strength in their hands or coordinated movements be able to hold on to objects. This is called a 3-in-1 commode, so this can go next to your bed for ease of use. It can go over top of the toilet to give you a higher surface and make it easier to get off of. And also it has handles to help with support if someone has a little bit of weakness in the core. If you're using this next to the bed as a toilet, then there's this bucket right here that can slide underneath and attach to the chair where the hole is so that you can empty the bucket when the person's done using the bathroom. You can also expect to be working with therapy, and some goals you might be working on will include strategies to ensure frequent, proper pressure relief and prevention of skin breakdown. You also will make goals on directing your own self-care and management of a bowel and bladder program. You'll be taught how to educate family, friends, and caregivers about how you would like to be taken care of and your needs, and also how to consult with your physicians and physical therapists on the potential of maneuvering a power wheelchair. And all of that wraps up what you need to know about what you can expect when you have a C1 to C4 injury.